Warm welcome to all of you who have joined us today for the AIA Live 2021 Environmental Wellness Dialogue. My name is Jessica Chiam, founder and managing director of EcoBusiness, and I'm delighted to be your host and moderator today. Now, the topic for today is an exciting and timely one. I think we all acknowledge now that climate change poses various threats to the health and well-being of humanity. The increased impacts of extreme weather events, rising pollution, infectious diseases, and changes in food security affects both the physical and mental health of billions across Asia. As the issues around climate change gain wider attention, it is also starting to impact people's well-being. A growing stream of studies have looked into how people's emotions and life evaluations depend on environmental factors, including temperature, air pollution, infrastructure, and natural disasters. There is therefore an urgent need to inspire collective action, especially among the youth, who will be our leaders of tomorrow. We thank AIA for organizing this important discussion, and we have very distinguished speakers to share their perspectives with us today. And I'd like to introduce them now. They are Mr. Renzo Guinto, Associate Professor, Practice of Global Public Health, Inaugural Director of the Planetary and Global Health Program at the St. Luke's Medical Center, College of Medicine. We have Mr. Tim Jarvis, an explorer, environmental scientist, founder of the Fork Tree Project, and AIA Vitality Ambassador, Australia. We also have Ms. Zhang Tingjun, co-founder of the Chain Reaction Project. Thank you so much, speakers, for joining us today. We have a lot to cover today, so I'm going to dive right in. The first topic on hand is climate change and health. And perhaps I can invite Renzo to share your thoughts on this perspective before inviting the other speakers. Renzo, over to you.
Climate change is already happening now. A few weeks ago, the United Nations Intergovernmental Panel on Climate Change, IPCC, released a report saying that every region in the world is already experiencing changing weather patterns, increasing ambient temperature, and increasing precipitation or rain as well. And so, the world is changing. Of course, COVID has dramatically changed the world already, and climate change is certainly at its backdrop. And of course, climate change is going to affect not just a single disease group. It's affecting infectious diseases like dengue and malaria, which are still very much prevalent here in Asia Pacific, but also non-communicable diseases like heat stroke, heart attacks because of exposure to, for instance, extreme heat. And there's also growing evidence that climate change is also affecting our brains and hearts. The growing effects on mental health, both in terms of the abrupt extreme weather events, when there's a typhoon or an extreme flooding and it displaces populations. So these are just some of the grave effects on climate change on health. They're not effects for the future. They're already happening now while we are still fighting an unseen coronavirus.
Perhaps I turn to Tim. Share with us your thoughts on this issue.
But I guess from my point of view, I tend to divide environment and particularly climate change and health into two sort of buckets, if you like. The first is the positives associated with a good quality environment, and the second, the negatives associated with a bad quality environment. And I think the negatives associated with the bad quality environment are quite well known. It's things like air pollution, and the figure that you quote is a well-known figure of 7 million deaths a year attributable to poor air quality. But of course, you have things like microplastics in the environment. And then you have all the negatives associated with climate change: extreme weather, viability of people's business, mental impacts upon them, spread of disease. But then the positives of a good environment are things like the microbes that are present in things like plants and fungi. Actually, it has been cited as the fact that them having a positive physical benefit on people's immune systems, for example, and in terms of lower cortisol levels, lower stress levels associated with nature. Again, I think it is now pretty well understood. I think people intuitively understand that they feel better when they're kind of in nature. And I think the indirect attention, as psychologists like to call it, of spending time in nature has a very calming effect on us, both mentally and physically. So climate. So I think there's two things we can do. We can make ourselves individually more, and our businesses and our way of life more resilient. But we can also make sure we're not adding to the problem.
Thank you so much, Tim. I think you make a very good point there about being responsible investors, or rather stewards of our finances as well as resources and the way that we live. Renzo, coming to you as a doctor, what must be done really to create a more resilient and healthier population in light of the climate crisis that we're seeing?
Strengthening our systems, our health systems, to be able to respond to the health consequences of climate change. COVID-19 is actually a dress rehearsal. We realize that our health systems are not ready for pandemics. All the more they're not ready for the long-term consequences of climate change. And so, as we proceed with the post-COVID recovery process, I hope that the future health systems will not just be resistant to future pandemics; they're also ready to address the myriad health effects of climate change that we just talked about a while ago.
Over to Ting Jin. When it comes to climate change and health, how much do you think we as individuals can make a difference?
I'm going to take it down to a very granular sort of individual, I am a person level, how it has affected me. And then I think in terms of what the individual perhaps can do. Don't worry, in a super nutshell. I think I have worked in the space of disaster relief for a number of years. And now I work in an ambulance as a medic. So I've seen the effects that climate change can have on countries, on communities, on individuals, and then now in the back of an ambulance, really on sort of a really face-to-face kind of level with the people that we have come through. But I think for me, living in Singapore, I've always seen these disasters as something that happens outside of Singapore. We don't have natural disasters here. Natural disasters, I think, is what is most closely associated with climate change, at least here in Singapore. Pollution, perhaps, when we look to other countries and we're like, oh, the air quality is bad. And we have that here too with haze, of course. But I think that what we are seeing in Singapore here, and that change in mindset that is coming down to the individual. But honestly, in the last couple of years, it has been raining incessantly. We have had these huge downpours, we've had flash floods, we've had weather that we haven't seen before, right? And Singapore as an island, with only 30% of our country, is less than 5 meters above sea level, right? If you talk about rising sea levels, it's having a direct impact on us now, and we're seeing that.
I would like to thank all our speakers for such an insightful and exciting discussion. You've been listening to AIA 2021 Environmental Wellness Dialogue, and with me is Mr. Renzo Guinto, Mr. Tim Jarvis, and Ms. Jang Ting Jin.